Hello all. Now we are reaching the fourth and the last lecture in rehabilitation medicine, and I hope you see the previous lecture, saw the previous lectures, and have a highlights or a big lines or something's important in the previous three. Sure, this is the last and the most important lecture in this session. It constitute of rehabilitation medicine and mainly concentrate on the brain with its illnesses, spinal cord with its illnesses. In short, how to rehabilitate paralysis. How to rehabilitate paralysis. If you know, paralysis related to the loss of motor and sensory functions of an organ or system. Paralysis means loss of motor and sensory functions of organ or system. The first slide shows you a few concentrated, condensed, applied anatomy. Applied anatomy. The title of our lecture is Rehabilitation of Brain Damage, Stroke, and Spinal Cord Trauma or Lesion. Maybe stroke is a strange word for you. I hope in neuromedicine you take it. Stroke means a brain injury which leads to paralysis. Stroke, damage is damage. Stroke means paralysis. Brain damage leads to paralysis, either hemiplegia, paraplegia, quadriplegia, monoplegia. Spinal cord trauma or lesion, also the same end results. As I told you above, our lecture is related to rehabilitation of the word paralysis, P-A-R-A-L-Y-S-I-S. In this figure in front of you, the blood supply circle of Willis. You must know it in anatomy, mainly neuroanatomy. The middle one is MRI study. MRI study is difficult for you, but I want to show you that this is the vertebral column. This is the vertebral column, intervertebral disc, CSF material, spinous processes, spinal cord material. The left one is the spinal column on the bone and intervertebral disc. That's what I will talk about. Anatomical introduction. Introduction for what? For brain and spinal cord. Why we study the brain and spinal cord? We study its trauma or lesions. What's the end results of their lesions? Brain damage or spinal cord is paralysis. The brain with its different parts, cerebrum, cerebellum, midbrain, medulla oblongata, escaped inside the cranium. Cranium is the bone cavity, while the brain its 5 parts. Spinal cord with its different parts, cervical, dorsal, proper cord, coda equina below the lumbar ridge, escaped inside the vertebral canal. Any traumatic, infective, vascular, metabolic can affect them, leading to motor, sensory, and sphincter dysfunction. If you notice, I collect the lesions under the following titles: trauma and its sequelae, infection means microorganisms in its different parts, vascular means vessels, blood supply, venous blood supply, metabolic related to the minerals, related to the diet, related to other lesions, can affect them, leading to what I told you, motor, sensory, and sphincter dysfunction. Paralysis, weather, sorry, the word weather is not right, I think, weather, W-I. Monoplegia, hemiplegia, upper paraplegia, lower paraplegia, and quadriplegia. Monoplegia طرف واحد. hemiplegia شلل نصفي. Upper paraplegia من umbilicus and above means the upper limbs. Lower paraplegia, umbilicus and lower down means the lower limbs. Quadriplegia means الأطراف الأربعة is the most prominent manifestation which needs a proper perfect rehabilitation process. What are the rehabilitation steps? If you remember, I said the word team, rehabilitation team in the first lecture. And the team consists of the following, which is important, I will ask you shortly. Period of instability. Period of instability either in the orthopedic department, in the neurosurgery department, or in the neuromedicine department. Instability. Whether at the neurological site for stroke or at the neurosurgical department needs rehabilitation advices at these sites and consists of proper turning to prevent bed sores. 3 lines under this word, proper turning to prevent bed sores. This is at the time of injury, as I told you above, either in the neuromedicine, neurosurgery, or orthopedic. This is the first step, proper turning to prevent bed sores, and we will speak later. Or passive full range movements of body joints to prevent contractures. إذا أنت طبيب مقيم وموجود بقسم طب الأعصاب، بقسم جراحة الجملة العصبية أو بقسم الكسور، وشفت مريض عندك وتسوي الكيس شيت مالته ولقيت الانجري مالته برين انجري، سباينال كورد انجري، vertebral column injury, don't forget to remember and teach his family proper training to prevent bed sores, passive full range movements of all body joints to prevent contractures in association with the proper posture. 2 important tricks, 2 important maneuvers, 2 important ideas which prevent a very big complication in a brain and cord injury. The fourth one, isometric exercises for innervated body muscles is advisable. Chest and cardiac physiotherapy is another necessity. If you close your eyes and remember what I said, turning, prevent contracture by passive movement, cardiovascular, respiratory, proper posture, and assistive exercises. Period of instability. After period of instability, transfer of the paralyzed patient is achieved after its stability. And كلمة stability depend on the type of the injury, the site of the injury, maybe 2 weeks, maybe 4 weeks, maybe 8 weeks, depend on the type of the injury, نوع الستروك أو نوع التروما وsite. Paraplegic and quadriplegic due to traumatic cause needs 4 to 6 weeks. How much? 4 to 6 weeks period of immobilization and sometimes up to 8 weeks. This immobilization process is a fixed one and it's always happened on the orthopedic قسم الكسور أو neurosurgery قسم الجملة العصبية أو neuromedicine بس most like neurosurgery and orthopedic. The third one, and start our job, main rehabilitation job. The team will start their job. Skin care, bowel and bladder care, skin care, bowel and bladder care, proper turning every 2 hours, talc powder use of compressed sponge as an elevators for more prominent body parts, trochanters, etc. to prevent body sores. You know what كلمة body sores means. قرحة الفراش. body sores قرح الفراش. trochanter هي نهاية عظم الفخذ. sacrum هو عظم العجز. هذه المكانات اللي دائما تصير بها قرح الفراش وبشكل منطقي وعلمي وفيزيائي. body B prominent parts اللي هي بون قوية وجوا بيتس اللي هي ثقل البدي يكون على prominent bony parts. اكو سكن اكو subcutaneous tissue. paralyzed limb without blood supply means sore قرحة الفراش. Use of Dilcolac suppositories 2 every other day at the morning to rehabilitate the bowel. Important thing, bowel. كل مريض الإنسان الصاحي أكيد كل أول الصبح يروح يقضي حاجة بالتواليت للباول أو لليورينيشن. هذا واجبنا، واجب الريهابيليتيشن تيم. شلون نخلي الإنسان اللي هو بارالايزد مشلول بين جبروت بين قوة بين عظمة، وإذا أصبح إنسان معتمد في حياته على كل شيء، شلون نعلمه ممكن نرجع له جزء من قابلياته. فالباول how to bowel motion is important, how to rehabilitate, clamping of the Foley's catheter every 2 hours to keep good bladder size. Good, not gut, good, keep good, GOOD, bladder size, خطأ إملائي, good bladder size. And then gradual learning of the patient how to empty his bladder, which depends on the level of the cord injury, and this either tapping method for the spastic paralysis, upper paraplegia, quadriplegia, or just pressing for flaccid type. I will concentrate on this. This is the main job of rehabilitation team. Look, bed sores قرحة فراش، شلون نمنعها؟ تيرنينج أكثر من مرة، نستخدم باودر حلو ونعلم أهله، نجيب سبونج 2، شكو منطقة بروميننت نهاية عظمية، نخلي اسفنج قبلها واسفنج وراها، بحيث المريض من ينام أو المريض من مطروح، المريض مطروح على الأرض، يكون البروميننت بارت ما عليها ضغط من الأرض أو من الفراش. الباول موشن الخروج أول الصبح ساعة 6-6:30 نطي حمالتين، يوم يومين 3-4-5 بين يوم ويوم، البطن تتعود، الانتستين تتعود أنه يبدي يقضي حاجة، ونكون إحنا ماخذين للحمام، همينا يقاضي حاجته داخل الحمام، وهم مسوي له حمام يومي أو حمام بين يوم ويوم. المثانة أصلا هي بلادر، وأنتم سامعين بالفيزيولوجي أوف مكتوريشن موضوع طويل اللي هو بي سنترال وبي بريفرال نيفز وبي كدني وميورتا. المهم اللي يهمنا البلادر. إذا خلينا فولي على طول راح تصير تيوب، إذا خلينا فولي البلادر تصير صوندة، تترك الوظيفة الأصلية مالتها اللي هي كاباسيتي مالتها، شلون تستوعب الإدرار وبعدين تطلع الإدرار بيعاز من الدماغ. المريض المشلول اللي يعازل من الدماغ اللي يروح بالنيرز مفقود. إحنا شو نسوي؟ نخلي فولي حتى نمشي الإدرار، ياخذ كل شيء اللي يريده، وإحنا نسوي مرة مرتين كلامبينج، نملي المثانة يعني نسده كلامبينج، نقرصه. فبالتالي إذا أكو مجال نيرف ريهابيليتيشن، سايت مال انجري عالي، نبقي فانكشن للبلادر لان بقينا له سايز حتى لا تحول الى تيوب. الجوينتس ان جنرال حتى نحافظ عليهم ما يصير عندهم كونتراكتشر ويكون المريض مكموش بوضع معين، هو نحرك الجوينت رينج كامل مرة او مرتين باليوم، يبقى محافظ على الرينج مالته. هذه النقاط الأربعة سكين، بلادر، باول، full range of the joint motion, prevent contractures. This is the main functions, this is the main job of rehabilitation team. Physiotherapy program up to 6 months is arranged to the paralyzed patients. This is after we pass the instability with immobilization, stable and the program rehabilitation in inpatient, then physiotherapy models may be inpatient and outpatient. What are the aims? Important question. Why we use physiotherapy program for a paralyzed patient? What we want? Prevention and correction of deformity, improve motor function to develop ability to carry out activities of daily living, ADL. إذا تتذكرون بالمحاضرة الأولى سويت لكم جدول بالADL أشكالهم، إذا يقدر وحده، وإذا يحتاج مساعدة، وإذا ما يقدر ينجز أي شيء حتى ويا المساعدة، وإذا مشلول صفر. Proper ambulation with suitable wheelchair، تحرك مضبوط، كراتشز اللي هي العكازات والبريسز المساند. 4 these goals are achieved by the use of all therapeutic exercises, passive, assistive, active and resistive, which I discussed in the previous lecture. إذن شنو الأيم بالفيزيوثيرابي؟ 3 prevent أو correct deformity، improve motor function, proper ambulation، التنقل المضبوط. 5 things which is very important to find is occupational, social and vocational service. هذه الكلمات تعني مريض with full power، مريض paralyzed no power or partial power. You must imagine what is his state, how he is thinking. انقلب من شخص يؤمر يقود هو الأصل متبع إلى شخص فقير صعبان حركته قليلة يطلب المساعدة. Our job, our aims are how to give him occupational, social, vocational services are used by occupational therapists, social workers. Paralyzed patient must end with an interesting, useful, substitutional work and be active member in society. example بسيط، مثلا احنا نلاحظ مريض عنده قدرة أن مشلول الأطراف السفلى لكن بالحاسوب جيد جدا، إذا نشجع عمل الحاسوب، سووا برامج يصير. وكلكم سامعين عن العالم الألماني المشهور اللي فيزياوي وينطي دكتوراه وينطي كذا وشايفين صورته مشهورين شلون يستخدم الكرسي أبو يمشي على الهواء، الكرسي أبو حركاته، وينطي محاضرات بكل جامعات العالم. وزير الأمالية الألماني اللي يوصل ألمانيا إلى الدولة الوحيدة بالعالم اللي تنتج أكثر مما تصرف، ميزانيتها دائما هي بيفاض مريض على كرسي مشلول يتحرك ويحضر مؤتمرات وينقل ويساهم كل شيء، لكن هو lower limb paralysis. هذا كله اعتمد على very good rehabilitation program, very good rehabilitation centers, very good well-equipped rehabilitation places. What are the steps we used? Treatment of common paralyzed patient complications، هذه مهمة تقريبا حكيناها. decubitus ulcers أو bed sores، قرح الفراش، تلقوها بكتب bed sores، تلقيها بكتب decubitus ulcers، تقريها بكتب عربي قرح الفراش. chronic urinary tract infection، بالمناسبة اللي يقتل مرضى الشلل هو urinary tract infection قوي، chest infection قوي، very big bed sores توصل حتى للعظم بحيث يفقد كل البلازما والبلاد ويتدهور وهي passed. 3 myositis ossificans، pathological fractures، spasticity، fertility and sexuality. These are the 6 steps we are looking to work in. These steps, I will tell you what we mean by all. As I discussed before, these steps, as I discussed before, I will just remind you. decubitus ulcers وين تحدث؟ بالتروكانتريك بروسيسز بالبون بروميننس. اذا احنا سوينا تيرنينج اوفر، use sponge, teaching for the personnel how to prevent them. Chronic urinary tract infection because the paralyzed patients are immobilized, can't turn over, can't stand up. There's a stagnation of urine. Each stagnation of urine means it's a good media for growth, microorganism growth and infection. Myositis ossificans may be strange for some of you, means calcification at a soft tissue. Means calcification at in the soft tissue sites. This calcification happens in paralyzed patient because of the disturbance in calcium and other places. Calcified soft tissue is common problem treated by treatment. There's a trial and it's not mainly approved. Etidronate disodium 20 milligram. Sure, I will give you an accessory or additional few papers to the lecture and to the slides I will have already discussed. Pathological fractures means demineralization of bone, osteoporosis. سؤال، ليش يحصل عند أهل الشلل osteoporosis؟ كلمة osteoporosis means تنخر أو هشاشة العظام. ليش يحصل عندهم؟ لأنه إحنا عظامنا الأصحاء تعتمد على الصن اكسبوجر وفيتامين دي، كالسيوم ناخذ على طول، والموفمنت اكسرسايز. إذا الاكسرسايز ماكو، صن اكسبوجر ماكو، كالسيوم ودايت ديستربز، يصير عندنا demineralization and this lead to what's called pathological fractures or secondaries from other lesions also cause pathological fractures. Spasticity, this is an important term like rigidity, but spasticity related to increase in tone, hypertonic، مو اكو هايبر ريفلكسيه وهايبر تونس او increase in tone continuous abnormal increase of the resistance of extremity to passive stretch is treated by diazepam or baclofen lyocell. The last one is fertility and sexuality. Oh, it's a very common question, very common intervention, very common asking you. دائما يسألك مريض الشلل أني شلون أنجب لو ما أنجب، يصير عندي طفل لو ما يصير، أني متزوج، أتزوج لو لا. This is a very huge and important problem, and the answer is these patients with paralysis, they have reflexogenic erection, and he will tell you, doctor, I always have erection, but it's not an healthy erection. It's reflexogenic erection. Takes place in cases of suprasacral lesions or above the conus medullaris, but not in the lower motor neuron lesion. Reassurance is very important for these patients. Studying of the physiology of sexuality and urination is very important. You prepare yourself, if you are a rehabilitation man, to answer all these questions. How to build family, you must answer them, how they will in the future get in. To solve the infertility problem, artificial insemination, either through electric vibration or on the glans penis, or the use of intrarectal electroejaculation. Very important and very new devices are already established to answer this question. This is for the professionals, and I hope you get a good benefit. And I so thanks, dear sons, dear sons, I hope I gave you a short condensed subject in rehabilitation medicine. Don't be afraid. Sure, I will help you in everything, whether in the questions, whether in the how to give the marks for you. And I'm so thanks, and I hope you are ready for next assessment, and thank you.